How long can a baby go without pooping? Is 18 days too long to go without pooping? A mom of a 3-month-old asked. Believe it or not, yes, sometimes this is okay. How long is too long for an infant to go without pooping? The answer depends on age and diet, but most of the time babies that won't poop are fine with little or no treatment. Here's why babies can go a long time between bowel movements, and when you need to be concerned about constipation and other rare medical emergencies. Constipation is rare in breastfed babies. Infants older than 8 weeks often go 4 or 5 days without a dirty diaper, and it doesn't mean they are constipated. Breastfed babies, especially if they have not started solid foods, can easily go 2 weeks without a poopy diaper once they are 2 to 3 months old. Breast milk is exactly what your baby needs, and so there is little waste product left for the baby to poop out. Exclusively breastfed babies are almost never constipated. They may go a long time without pooping, but their belly is not full of poop. If your baby seems uncomfortable, there is probably something else wrong. Breast milk is a natural laxative, and exclusively breastfed babies who have not started solid foods almost never need a laxative. Constipation is common when switching to solid foods. Formula-fed babies and babies who have started solid foods often become constipated, but it is easily treated. If your baby seems uncomfortable, is straining to have a bowel movement, or is having hard, solid stools, they are probably constipated. Try massaging your baby's belly, giving him or her a warm bath, or taking a rectal temperature. Taking a rectal temperature stimulates the rectum and also checks for a fever, which could indicate a more serious reason why your baby is uncomfortable. If your baby is still constipated and does not have a fever, try 1 ounce of prune or pear juice and/or an infant glycerin rectal suppository. Infant suppositories are available over the counter at any pharmacy or by prescription from your pediatrician. Newborn babies poop frequently. Newborn babies often poop after every feeding, about 6 times per day. In the first few weeks after delivery, your baby's intestines are maturing and becoming more efficient at extracting nutrition from breast milk or formula. As their intestines get better at digesting food, the time between bowel movements gets longer and longer. Before you know it, you have a 2-month-old that is going several days without dirtying the diaper.